whenever we look at the immune system, always be aware that we have to treat the immunity or the immune system according to how our immune system works. Okay? For example, a lot of you have heard of Echinacea. A lot of you have heard of golden seal, or maybe even used. A lot of you have heard of astragalus. And all of these can be very, very effective immune builders. In fact, astragalus in the research has been proven to increase natural killer cell activity by as much as 40 times. Natural killer cell activity is one of our best indicators for cancer risk. Okay? If the natural killer cells are asleep, they aren't out there checking who's healthy and who's not, who's okay to stay and who's not. And so astragalus is very strong at building that side of the immune system. So what we're actually looking for is a T helper 1 immune builders. Okay, and that's what we look at for on this side. The other side, we look at things like resveratrol, pine bark extract, which is called pycnogenol. And these can be very, very effective as antioxidants. A lot of people use them as that, but they actually build Th2 activation as well. Okay, T helper 2. Now what's the difference? T helper 1 is our cell-to-cell natural killer activity. Loves to go out and hand-to-hand fight. Whereas Th2 is more the chemical and antibody, I'll just use the abbreviation, antibody or memory cell producers. Okay? A lot of times, if I have an autoimmunity, if one side is already overactive and I take more of those Th1 helper builders, I may feel really cruddy. Or if I take something like this that's supposed to be helping or healing, I may end up finding myself more sick. Okay? I'll give you for example. There's a lady that we worked with who, when she was exposed to resveratrol, pycnogenol, or even green tea extract, her body would take a dump and she would get intense migraines. Okay? In her case, though, running down her spine, on either side of her spine were these long metal rods called Harrington rods. Because her spine wasn't straight, it looked like this, right? And her body already had an autoimmune reaction to these spinal rods, and if she was exposed to any of these products, she would just almost go into coma. It made her sick, okay? Because she is already very Th2 dominant, so it would overwhelm her system. If you take Echinacea, golden seal, astragalus, this product also has in it licorice, and which is very tonifying to the adrenals, and lemon balm. But those things are all natural killer cell activators. If we use those and you feel worse, you probably have already a dominant Th1 system. So again, listen to your body and be aware of what works for you. Don't just take it because your neighbor said, oh, take Echinacea, or because we're talking about tonight things that build your immune system. What I'm saying is, be aware. Okay? There's a difference between beware and be aware, right? Be aware. Please.
How does, when a lot of these symptoms you're talking about, a lot of people say zinc really helps, and the zinc lozenge and all that. How does that work? What is the zinc doing that's helpful?
Sure. So the question is, how does zinc strengthen immunity? Zinc is a cofactor primarily in blood sugar utilization. Blood sugar is what we use to activate all cells, to feed the cells, right? So zinc is actually essential for activating the immune system, but also for utilization of our sugars. When you look at people who have blood sugar imbalances, we use zinc and chromium picolinate together because it really strengthens, and zinc is essential as a cofactor for insulin utilization in the body and in the cells. Okay? So that's where we look at that as a cofactor primarily. Okay? We've talked about zinc also in heavy metal toxicities, particularly in copper toxicities, bladder spasms, and those bladder spasms that are released at night causing nocturnal enuresis or bedwetting, okay, especially in little boys. Okay, so great question. So again, we use XFLM, which is the pine bark extract, green tea extract, grapeseed, and resveratrol, pycnogenol, all of those. Okay?
So you'd use this if you were T1 low, right?
No.
Or T1 dominant.
Correct.
To bring it up.
Correct. We may. Now here's the other thing.
Because I'm on this, but I don't know why.
It is to build up your TH2.
Okay.
Okay?
It helps you if he has a cold.
So there are other times though when even with the autoimmunity, let's say that a person has Epstein-Barr virus, we do want to increase the natural killer cell activity, and even though they may have still a TH2 dominance, we may, or even a TH1 dominance, we may feed it even more to get rid of the virus,
Okay.
or hepatitis C or something like that.
Okay.
You'll remember reading that in Dr. Krazian's book.
Yeah, yeah.
Okay? And then the X-Fireman is the other one that we may use.
Okay.
Okay? Now, the nice thing about some of these, for example, astragalus is something that you don't just build a tolerance to. It actually will bring up your natural killer cell activity and hold it. And you don't have to stop using it. So sometimes we'll actually, if you can tolerate this as a tonifier of your immune system, you may use one of those a day, and especially if you're going to be traveling, you know you'll be traveling in a place where it's foreign or on a plane where a lot of people have been sick, you may want to use one of those every day. Okay? So, anyway, just FYI. Okay? Last thing that I want to just mention then is with respect to once everything's been eliminated, okay, and there's nothing to come out and you're just getting the dry heaves, now what are you doing? Now you're responding a lot to just pain, right? So there's just that cramping and that incessant cramping in the gut. May need some help to build the immunity there. The thing that I like to use with kids is something called soybean lecithin. We can just pierce the little gel cap and express it in their mouths. My kids call them poppy pills. They'll actually bite them and swallow them. Okay, swallow it kind of comes out kind of a waxy gel. And I like to recommend that to help to calm the irritation of the stomach once they've had the vomiting and diarrhea. Okay. Another thing that's very, very effective at flu symptoms is another homeopathic. In Oregon, actually, a lot of the MDs were recommending this. Once people had a flu shot but were still getting the flu, now what do? Well, they were actually recommending this little homeopathic, and it comes in they're little tiny pearls, and each one's a single dose, and you just take it in your mouth and hold it under your tongue, and they work very, very well. You've used those before.
Do your kids ever get sick?
Of course. They have symptoms. Yep. Yeah, in fact, it was me that had the flu this morning at 4 o'clock, but I used these things and my laser, and I was feeling better by 11. Okay. What's the best prevention for
Hand wash.
flu? Hand washing. Okay? Teach the kids to wash their hands. ABC, Miley's great at singing ABC in front of the sink. Does a great job with that. She gets the cracks and the fronts and the back. Okay? Teach your kids how to wash their hands and remind them that the most important thing is if you haven't had a chance to wash your hands, do not touch your face and eyes. Okay? Your eyes, your mouth, your nose. Because what you're going to do is introduce that virus and increase the likelihood of yourself becoming infected by that. Okay, please.
Do you think the hand sanitizers and the antibacterial washes decrease the immunity of the bacteria that's naturally on our hands?
Yeah. I won't comment a lot about that, but yes. Okay. Any other questions? So when we look at the body, remember that there are 4 primary barriers. There's the skin is a barrier, the lungs have a barrier, the gut is a barrier, and there is a blood-brain barrier. Okay? And what we find often is that if there's a breakdown in one of these barrier systems, and one of my biggest concerns with a lot of the antibacterial soaps now is, I wash my hands in between every patient, as do you. And because of that, we get a breaking down of our own skin barrier, right? So one of the things that I always recommend is if you're using something that's drying you out so much that you have deep fissures, you need to back up a little bit and use something that's going to be effective without destroying those barriers. Okay? But it's very, very common. Any other questions?